Module number 01 Introduction and Significance of Health and Safety. The basic concept of health and safety. Health. The non-existence or absence of disease is termed as health. It is a condition in which there is no symptom of illness or sickness. It includes physical as well as mental health. For example, asbestos creates a health risk because if you inhale asbestos dust you may contract lung cancer at some stage later in life, perhaps 20 or 30 years after you inhaled the dust. Health relates not only to physical ill health but also to psychological ill health, e.g. exposure to extreme stress can lead to acute mental collapse or a nervous breakdown. Safety. It means no risk of serious personal harm or injury. It is a risk-free condition of human life. If you stay out of the danger area, you are in safety and protection. For example, walking under a load suspended from a crane during a lifting operation is not safe because if the load falls, serious personal injury or death could result. Staying out of the danger area results in safety. Significance of health and safety. The moral reason for managing health and safety. According to the International Labour Organization, ILO, in 2012, about 340 million incidents in occupational health and safety and a total of 6,000 deaths recorded every day. According to society, the practice is not acceptable if a worker makes any money to feed his family but gets killed or injured by the job or work she is doing. A worker will have to suffer a lot of pain, psychological stress, lifelong injury, permanent disability, with possible job losses due to an accident. A worker may be a single person of his family who is on the job. Because of the accident, not only the worker but also his family have to suffer financial crisis. So it is the employer's moral duty to protect its workers and provide them with a safe and healthy working environment. Similarly, the following global statistics have been published by the International Labour Organization, ILO, as part of their Safe Work program. You do not need to remember the actual figures. We give them to highlight the scale of the problem. There are over 350,000 work-related fatal accidents reported each year. Half of these occur in agriculture. Over 2.75 million people die every year from occupational accidents and occupational diseases. Around 2.4 million of these deaths are attributable to occupational diseases. There are over 270 million occupational accidents and 160 million occupational diseases recorded each year. 4% of the world's gross domestic product is lost each year through the cost of injury, death, absence, etc. Financial reason. There is a commercial aspect of health and safety because unintended accidents and events can cost money. Different governments find that inadequate occupational health and safety management raises additional costs for the economy, such as disabled workers' compensation and the expense of their medical treatment. Due to these sudden accidents, there are direct and indirect costs which organizations may face. Some of these costs insured, but others are not. Insurance means you save something as compensation. It also includes direct and indirect costs. What are direct and indirect costs? Direct costs. Direct costs arise directly from accidents and can easily be calculated. Direct costs could be insured or uninsured, that depends on the reason for the loss. As well, many small costs may not be covered by insurance of the company due to their policies, because the insurance company wants the employer to meet some of the costs of losses. How direct costs affect. Legal fees. For example, when defending a claim form, the injured person for compensation or prosecution in court are typically insured. Worker sick pays continual to the injured worker or his/her family. Cost of the accident and ill health due to lost production. Repairs to, or replacement of, damaged tools, vehicle, equipment and building. These are subject to the type of accident and insurance company policy. For example, fire case may be covered by insurance, and maybe machinery like vehicles are not included. Compensation is payable to the victim, employee or others, of accident or ill health, which could be covered by employer liability insurance. Overtime to meet the production target. Costs associated with the recovery of the injured worker, like medical treatment, first aid, hospital admission, doctor and medicine charges. The insurance premium will be increased due to the accident. Indirect costs. These costs are indirectly arising out of the event. Indirect costs cannot be measured frequently. They can hardly be identified. How indirect costs affect. Workers will not be able to perform their regular job while investigating an accident, e.g. manager, supervisors. The morale of the workers will be affected, and they will not feel safe at the workplace, and it will ultimately lead to a reduction in production. Cost of remedial action following an investigation. Lots of time while preparing reports, attending enforcing agency meetings or during the hearing of courts. The cost associated with the hiring of new staff and their training, etc. Loss of organizational goodwill of customers due to delays in production meeting on-time orders. Fine form court during the legal proceeding. Industrial relations will be compromised, and it could lead to removal from a trade association. Accident, incident. An incident, in the context of occupational health and safety, is an unintended event that disturbs normal operations. OSHA defines an incident as an unplanned, undesired event that adversely affects completion of a task. Incidents range in severity from near misses to fatal accidents. Safety and health incidents are not always serious in their effects, as is the case with near misses, events that could have resulted in a serious accident but all serious damage or harm was avoided. However, companies typically respond to even minor incidents, either by recording them to analyze and track safety metrics or by taking proactive steps such as holding a quick safety meeting to discuss the event or conducting a review of the events that led to the incident. While it is often used interchangeably with accident, it is a different concept. Accidents are a subset of incidents, but some events that don't qualify as accidents are counted as incidents. Hazard. A hazard is any source of potential damage, harm or adverse health effects on something or someone. Basically, a hazard is the potential for harm or an adverse effect, for example, to people as health effects, to organizations as property or equipment losses, or to the environment. Sometimes the resulting harm is referred to as the hazard instead of the actual source of the hazard. For example, the disease tuberculosis, TB, might be called a hazard by some, but, in general, the TB-causing bacteria, Mycobacterium tuberculosis, would be considered the hazard, or hazardous biological agent. Unsafe act, and unsafe work conditions can be defined in several ways keeping in view of nature of industries and working places. Near miss. A near miss, near hit or close call is an unplanned event that has the potential to cause, but does not actually result in human injury, environmental or equipment damage, or an interruption to normal operations. OSHA defines a near miss as an incident in which no property was damaged and no personal injury was sustained, but where, given a slight shift in time or position, damage or injury easily could have occurred. Near misses also may be referred to as near accidents, accident precursors, and injury-free events. A near miss is often an error, with harm prevented by other considerations and circumstances. Heinrich Law, Behavior-Based Safety, in his 1931 book, Industrial Accident Prevention, A Scientific Approach, Herbert W. Heinrich put forward the following concept that became known as Heinrich's Law. This is commonly depicted as a pyramid, in this case with the number of minor incidents shown as 30 for simplicity. Heinrich's Law is based on probability and assumes that the number of accidents is inversely proportional to the severity of those accidents. Heinrich's work is claimed as the basis for the theory of behavior-based safety by some experts of this field, which holds that as many as 95% of all workplace accidents are caused by unsafe acts. Heinrich came to this conclusion after reviewing thousands of accident reports completed by supervisors, who generally blamed workers for causing accidents without conducting detailed investigations into the root causes. While Heinrich's figure that 88% of all workplace accidents and injuries, illnesses are caused by man failure is perhaps his most oft-cited conclusion, his book actually encouraged employers to control hazards, not merely focus on worker behaviors. Thanks for watching. Please subscribe my channel.